Back here on this Sunday morning, Steve Cashel, Dr. Brian Cole at Sports Medicine Weekly. Time now for our Ask the Doctor segment, getting our listeners involved. Very easy if you want to take a chance and have the doc answer your particular sports medicine injury issue. Just go to our website, sportsmedicineweekly.com. On the homepage, you'll find the link with Ask the Doctor. It's underneath the picture of yours truly and Dr. Brian Cole. Click on that link and you can submit a question. Got a good one here, Dr. Cole, from one of our listeners. How do surgeries differ from pre-COVID times? Anything different in your operating room these days?
It's interesting, Steve, I think back to when HIV and hepatitis was pretty common and how we changed our practices. And we have this thing called universal precautions, which is eye protective wear, gloves, then we went to double gloves, things of that nature. We're now living in a time where we pretty much assume everyone has COVID. And what's really fascinating is all of our patients, this is an Illinois Department of Health mandate that they all have to get tested within 72 hours of surgery to show that they're COVID negative. It's a little, in my mind, it's a little bit of a shame that we do that because less than 1% have been positive, and we're still dealing with testing challenges, to be frank. So I in some ways, I think it's a self-selected population that understands it and is kind of following the rules in general. That's why our positivity rate has been less than 1%. And if they're positive, we don't operate on them. But that being said, if you were in the operating room right now, you would be treated as if you were positive. Every interaction is as if everyone around us is positive. So that means we're in the recovery room, in the reception areas, not just the operating room, we're wearing a mask. And when we clean the rooms, we did change policies where we have more downtime to let aerosolized or respiratory things be circulated out in the ventilatory system. So we have more downtime in between cases, and we take some added steps. But every interaction is as if someone's positive. So I still stay 6 feet away even with a mask unless I have to do a physical exam or other. The patient gets an IV, the nurse has the least amount of time physically in contact with that patient, and everyone is wearing a mask all the time. So that has changed. Our ability to do surgery, the efficiencies are generally okay. It feels really safe. I can tell you, much like airlines where people worry about flying, and I take care of a lot of pilots and flight attendants, and I always ask, and I'm like, look, what's going on in your business? And there's not an epidemic of people at this point of pilots or flight attendants getting COVID. Similarly, there's not an epidemic of doctors treating patients in all environments getting COVID. And that's even in an environment where people are known to be COVID positive, as long as people are taking proper precautions. So I hope that gives you a sense of what's different. The good news is that we're able to function and take care of people because, being in pain and not able to be active and not able to work, that's kind of a big deal. And we need to still be able to take care of our patient, and we've learned to live with the threat of COVID all around us.
Okay, Dr. Cole, great stuff. Interesting. I appreciate the efforts and working with you, and I wish you to stay healthy and your patients and staff, and we'll talk with you again next week.
You got it, Steve. Great show.
Many thanks to our producer, Shane Reardon, also to David Cole. He manages our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Cashel. We say so long for now. Thanks for listening to Sports Medicine Weekly. Again, our website is sportsmedicineweekly.com, and you can access podcasts from our shows, such as Apple, Spotify, YouTube, iHeartRadio, wherever you get your audio podcasts from. For Dr. Brian Cole, I'm Steve Cashel. Thanks for listening. We will talk with you again next Sunday, 7 a.m. Central, for another edition of Sports Medicine Weekly, only on
670 The Score.